Hello, HPP colleagues throughout the country. My name is Captain Kevin Sheehan. I'm the Field Project Officer in Region 9 here in San Francisco. Today's webinar will be a hands-on demonstration of the Coalition Surge Test. The purpose of this webinar is to provide you a hands-on demonstration to go over an overview of the surge test and to go through the different types of Excel spreadsheets that we have so that you have more comfortable putting this exercise on, as it is a requirement beginning July 1st, 2017 in BP1. Let's get started. Where do I find this? Where do I find information on this? So the way to do this is, if you don't have the materials already downloaded, go to Google CST Surge Test and just click on that link, and it'll bring you to our homepage, the Healthcare Coalition Surge Test on phe.gov. Hope many of you are familiar with this, with phe.gov. So we've got a number of things. We've got a page. It's a real good overview, general overview of the surge test. If you need something to share with coalition members or some of your leadership, this is a real good area to start, to cut and paste, or to use the information here and share it. We also have a video of one of the exercises we did down in the Southeast Texas Coalition near Houston. We did a video when we were pilot testing the surge test down there. We have a video from Lori Upton from CTREC also about what is the Healthcare Coalition. Prior to this webinar, we had a webinar back in February that was more of a high-level overview that included our partners from South Dakota, Michigan, Texas, and Wyoming about their experience with pilot testing the Coalition Surge Test. We have a Coalition Surge Test manual that we're going to get into in detail here in a bit. And then what we have here is the actual files you're going to need to put on the Coalition Surge Test. Click on that, and you'll get your zip file come on up. So what you can do there is we have the Coalition Surge Test Peer Assessor's Handbook Manual, both in a PDF format and in a Microsoft Word document format. And also we have the two tools, the EVAC tool and the LEAD tool. We're going to talk about all these in detail. What I suggest for everyone to do is to start in the manual. This is the Coalition Surge Test. It's an exercise for assessing and improving healthcare coalition readiness, and it's a handbook for peer assessors and trusted insiders. So I'm going to go through this manual in detail, and I wanted you to be able to understand what's in here. Encourage everyone to begin by reading this Peer Insider and Trusted Insider Handbook, because it really gives you the foundations of what you need to put a successful exercise together. Obviously, over here, we have an outline. We have information of what you can do before the exercise, during the exercise, and after the exercise. We have appendix, a checklist for the trusted insider, and then we also, appendix B is a sample notification for coalition partners. Let's spend a few minutes going through this in a little bit more detail. This document briefly describes the motivation behind the CST, the resources it requires, and instructions on how to use it. Detailed step-by-step instructions along with data collection and reporting tools are provided in two accompanying Microsoft Excel tools. There's going to be two phases to the Coalition Surge Test. Phase one is a tabletop exercise with functional elements and a facilitated discussion. The exercise during the first phase lasts 90 minutes, but a 60-minute advance warning is given before the exercise begins. Phase two is an after-action review, which is 30 to 45 minutes, and an after-action review concludes the CST and consists of an assessment of strengths and weaknesses and corrective action planning. Ideally, this should occur immediately after phase one, but it can be rescheduled at a later date to ensure or try to maximize healthcare executive participation. We would like the after-action review to be conducted as soon as possible after phase one, ideally the same day, but it must occur within 30 days of phase one. So this is a low notice, no notice hospital evacuation scenario. So the features of this exercise are that members of the coalition should be notified that an exercise will occur within a 2-week window, but they will not know the exact date and time. Assessors will select which facilities to play the role of evacuating facilities. They should not divulge this information to coalition members. So the evacuating hospital overall should not know that they're going to be the ones selected until 60 minutes prior to the start of the exercise. Applicable to coalitions without active response roles. We know that there are some healthcare coalitions that have an active role in response, as well as some coalitions within the country that don't have a role in response. So we want to make sure that everyone understands that we can use this tool for both scenarios. Evacuating facilities should act as they would during a real evacuation, to find spaces, whether this involves coordinating with a coalition command center, reaching out to receiving facilities individually or otherwise. However, an evacuating hospital would act on the exercise day or any real-world evacuation scenario, this is how we like them to play during this exercise. Let's talk about some of the resources required to put this exercise on. The most important person you're going to have really begin this process to initiate this is going to be a trusted insider. A trusted insider will serve as an internal point of contact for the coalition. Once the coalition has decided to run the exercise, this person should have an authority to recruit peer assessors. Players, the tabletop exercise portion of the exercise requires each evacuating facility to involve a minimum complement of personnel to staff the facility's command center. We don't dictate in terms of this exercise how large the incident command system within an evacuating hospital needs to be. It's whatever that evacuating hospital chooses to activate at that time. Players will be asked to obtain a current patient count and to work with coalition partners to identify appropriate destinations and transportation for all patients. So you can see in Table 1, under players, you're going to have minimum complement of command staff at each evacuating facility, a senior staff member at each facility receiving simulated patients, so there's no movement of actual patients. These are just simulated patients, an EMS patient or transport staff. On the peer assessor side, you're going to have a lead assessor in the regional coordination center or other appropriate location, an evac assessor at each evacuating facility, and a trusted insider who serves as an internal point of contact within the coalition. The peer assessors have an incredible important role in this exercise. The exercise requires an evacuating facility assessor, we call evac, at each evacuating facility, and they're going to observe the 90 minutes of initial tabletop exercise. In addition, a lead assessor is needed to launch the exercise, see below, and facilitate the discussion in Phase 1. The lead assessor works with a trusted insider to identify the best location from which to execute these functions. You see this handbook is very detailed, walks you through what you really need in terms of the resources. Again, we're looking at, on this page, laptop computers are needed. Each assessor will need a laptop computer that's capable of running Microsoft Excel. And then after the initial 90 minutes of the evacuation exercise, we want you to find some physical space or do this by conference call to host the facilitated discussion. Tools for before the exercise, this handbook should be read, and then the preparation checklist of the trusted insider is Appendix A of this document. And during the exercise, which we're going to cover in greater detail, the Microsoft Excel tool for the lead assessor and the Microsoft Excel tool for the evacuation assessor. The lead and evac Excel tool. The Excel tools are used by peer assessors before and during the exercise itself. Each tool includes sequentially organized tabs that may be viewed by clicking on each tab's name at the bottom of the screen or at the top. Each Excel tool includes the following components: an overview, preparation, and sequentially organized tabs for each part of the exercise. So as we go through here, you can see before the exercise, there's information here what the trusted insider needs to be doing, how the trusted insider should be identifying evacuating facilities, and then determining what participants they will need to run this exercise. During the exercise, immediately before and after, they will initiate the tabletop exercise portion. A lead assessor places a telephone call to a point of contact at each selected evacuating facility and informs him or her that the exercise will begin in 60 minutes. However, the assessor should instruct the evacuating facility not to begin exercise play until the assessment team arrives. If the first facility declines, the lead should call another facility on the list provided by the trusted insider. So it's important to have a number of evacuating hospitals identified that are willing to participate. For some reason, the one that you select has some kind of issue going on that day, that morning of the exercise where they cannot participate. It's important to have some backups. And so there's information here on notifying players on the time of facilitated discussion and then key activities during the tabletop exercise. Once play has begun, the evacuating facility should focus on contacting coalition members it would contact in a real evacuation scenario. After the initial 90 minutes, then you transition over to the facilitated discussion part of Phase 1. So Phase 1, again, is the actual evacuation scenario exercise, which is about 90 minutes, and then a facilitated discussion, which is about another 90 minutes or so. In the facilitated discussion portion, the lead will ask the evacuating facilities to review their patient count at the beginning of the exercise, which facilities agree to take their patients, Other players are invited to note discrepancies, and this is followed by a guided discussion that involves all participants. Next, the lead asks for similar information about transportation of patients, again followed by a broader discussion among participants. Finally, the discussion turns to patient tracking and communication, at-risk populations, and continuity of operations. The Excel tool will help walk you through all of it. Then there's some information, obviously, on the after-action review. Things to keep in mind as one of the assessors: avoid excessive prompting, no vague or inconsistent statements or actions for follow-up during the after-action review, and deliver text marked read verbatim. We'll discuss that right now. Say again is the preparation checklist for the Trusted Insider, and Appendix B is a simple notification for coalition partners. It kind of gives you a draft of what you can send to your coalition partners or leadership, informing them of what is going to happen and what the overall process is for this exercise. That ends our review of the Coalition Surge Test Handbook for Peer Assessors and Trusted Insiders. So let's go to the actual tools. We're going to start with the LEAD tool. We call it the LEAD tool because this is the tool that the assessor would use if that person were watching this exercise from some type of regional healthcare coalition coordinating center. Wherever that facility is or capability is, that's where we would like the lead assessor to be located. The evacuation assessor will be located at the evacuation hospital. So there's two tools, two Microsoft Excel worksheets. We're going to first cover the lead tool. As you can see up there, it's called Demo, the CST lead tool. The one after this is going to be called the EVAC tool. First, we're going to cover the CST lead tool. So let's go over this tool. We assume that maybe not everyone will get through the Peer Assessor Handbook, and we hope you do, but we have all the information you need right here to really take this and run with it. On the overview, we have information of how you use this tool. In the gray area, we have input data, type in cells that are shaded and information that we'll need, talking points or discussion questions to facilitate conversations, read these scripts out loud. Those are written in blue italics. Reading the scripts is important because it helps fill in a lot of gaps for the players and a lot of assumptions that they have, so it will facilitate and make the exercise move along better. If you want to take this spreadsheet and print it off as a PDF format and have it as a piece of paper, if that's easier for you as an assessor to work with, you can click there and get an Adobe Acrobat document of these spreadsheets, of this workbook with all the spreadsheets there. Also on the overview page, obviously we're going to have an overview and ensure that people understand that there'll be no movement of actual patients and that evacuating facilities will collectively representing 20% of a healthcare coalition's acute care bed capacity. Peer assessors administer and evaluate exercise. At least 2 are peer assessors, so we went through some of this information already on the Peer Assessor Handbook. And the Trusted Insider, you understand the role of the Trusted Insider. We talk about the 2 phases, but we give those 2 phases again here. Overall, about 4 hours for this exercise, really from beginning to end, including both phases. This tool is going to provide instructions and scripts and data collection tools, and the summary of the worksheets is provided below. If you see down here, we have a number of worksheets, and we have an explanation of what that worksheet is here. So let's move on to the preparation worksheet. That's the overview one. So in the preparation worksheet, this is very important to have up front. This is what you as the Trusted Insider and your peer assessors will do before the exercise. You're going to figure out if there is an RHCC or some type of regional healthcare coordination center, where that is located. Obviously, you have someone inside who knows this very well. It won't be secret. You have a number of where that location would be. And now you're looking at the number of hospitals. Let's just say we're going to look at number of hospitals within the healthcare coalition. I type this in. Local healthcare coalition, you can do the same. I gave it just for simplicity, 1,000 beds, and we have 5 different hospitals within the healthcare coalition and the approximate number of acute care beds per hospital. Also, obviously, you're going to want to know the primary point of contact or primary and secondary, because this is the information you're going to use to call them up on exercise day and say, hey, you've been selected as the evacuating hospital. And if that person, for some reason, you can't get a hold of, they're not in that day, this is a no-notice, low-notice exercise, hopefully you'll have a secondary person you can get a hold of, and then you get down from there. Obviously, you can put the date and the start time, and then a week before, you want to put a roster of organizations and people you want to contact to be included in the facilitated discussion. Either you do this by email or however a healthcare coalition would communicate with their healthcare coalition members. You probably already have this information. You probably don't need to put it necessarily here. You might have it in some other organized format. Either way, we just encourage you to have this ready to go so you can invite them all to the facilitate discussion. Even for those hospitals or long-term care facilities or other healthcare coalition partners who did not play in the exercise, it has been communicated back to us even during our pilot test, that participating in the facilitated discussion was very helpful for them, even though they didn't get the chance to play in the exercise for one reason or another. So during the exercise initiation, let's go to the end of this. Let's go to the next tab. You're initiating the exercise. We're going to choose Hospital C as our evacuating facility, and then you write your assessor. You type this information in. You could have up to 3 on this current tool. If you need to evacuate more than 3 hospitals, we encourage you to have another assessor because there's a lot of information coming forth, and it'd be very difficult for one assessor to be tracking more information from more than 3 hospitals at one time. Here are some talking points you can give to the RHCC staff. It walks you through what you can do. You can read all this ahead of time. And then it gives you some frequently asked questions and answers that you can provide to the players if asked. So that's how you'd begin to initiate the exercise. So now the exercise, you're walking in, they know you need to evacuate for whatever reason, whatever scenario that you come up with. We don't dictate in terms of HPP on the CST what the scenario is. You determine what that scenario is. Now the exercise is underway. You're observing as a peer assessor what you're seeing at this regional healthcare coordination or HCC coordination center. So you're looking in terms of situational awareness, collect baseline capacity data from coalition facilities in a timely fashion. If you agree, you click in here. If you have some comments, you can type in your comment. So you can save all this information for later for discussion. So you can put it all into this Excel spreadsheet. If you make a mistake and don't agree and you think it's really neutral, you can go in and click out and click back in. Areas we're asking to get some qualitative information on are situational awareness, communication, transportation, patient tracking and information exchange, appropriate placement of patients, and then regional healthcare coordination centers. That's what you would do for the actual observation during the Healthcare Coalition Center. The next tab is when you get into the facilitate discussion. So after 90 minutes, you're filling this in during 90 minutes of play. You shouldn't have any more prompting of the evacuating hospital, but if you do, or from the other regional healthcare coordination center, you can ask. But typically, you're here looking at this information and trying to comment on it. Let's go to the facilitate discussion. So after 90 minutes, the end of the tabletop portion of the exercise, you're going to go to a facilitated discussion. Now you're going to ask some information from the evacuating facility. This information is real important, as you will see. It's important for you to type this information because then we'll be able to save this information later and you'll be able to report this information as needed. We talked about Hospital C as evacuating. Let's say their patient census at the start of the exercise was 200. They were able to determine that they could evacuate or discharge rather than evacuate 25 patients. From the start of the exercise, how long did it take to complete your patient count? Let's say 33 minutes. I'm making all this information up. From the start of the exercise, how long did it take to receive confirmation that appropriate beds were found for all your evacuating patients? Let's say 88 minutes. Evacuating facility 1, you need to read this. Please briefly walk through each facility that agreed to accept patients. For each list of number of patients accepted in each of the following categories: long-term, general, med-surg, ICU, PEDS, NICU, labor and delivery, and psychiatry. The RHCC and receiving facility should listen closely to the report and note any discrepancies you find. This is the patients transferred from evacuating facility 1, Hospital A. We just identified these number of beds from these receiving facilities. So on the left here, you're going to have receiving facilities, Hospital A through E, and then you need the long-term care facilities that are participating. And down here, let's say in the 90 minutes, we found 55 total beds at that point. If you want to add another evacuating hospital, hit that button, yes, and then you can add another table for evacuating hospitals. Let's continue on in the discussion of the transport. This is still part of the facilitated discussion. We just completed patient beds. Now we're going to talk about patient transport. And again, from the start of the exercise, how long did it take to identify available and appropriate modes of transport from the last evacuating patient? Let's say 85 minutes. And then you're going to read through the information in blue. Put your name of your transportation organizations here. I type that in. And then you put your ALS or BLS or other vehicles provided in the description. And the number of patients matched the transport. Let's say in 90 minutes they were able to identify 18 patients in transport during the exercise. Again, if you know the facility, you can click that yes button to add another facility. So we're still in the facility discussion. We're going to talk about some other topics. There's some questions that you can ask about patient tracking and public communication, or at-risk populations, continuity of operations and recovery, wrap up. If a healthcare coalition has other things that they're interested in talking and assessing, they can always add additional questions down here if needed, or they can just verbally bring those up. So these are just some suggestions we'd like for you to talk about during the facilitated discussion. During the after-action review, we have some information here that gets populated by the cells that you typed in earlier. So hospital C, number of patients at the start was 200, number of patients discharged 25, number of patients placed was 55. Total ALS and BLS vehicles identified was 24. We go down to here, and during the play, we're able to identify beds for 55. And then at the end of the exercise, we're still probably looking for beds for 120 out of the 175 patients that were evacuated. At this point, so you can save this as an Excel or PDF, we'd really like for you to save it as anything that you want to save it for. You're going to use this information later to provide up to your awardee, to the state or to the territory, and so that they can provide information back to HPP at the end of the year. HPP is identifying 8 different performance measures associated with the coalition search test. Of here, we're going to track percent of patients at the evacuating facilities that are identified as either able to be discharged or evacuated to receiving facilities. And so this information is all populated from previous spreadsheets, and obviously your percentages are calculated here. So this information is already done for you, that you can save this and use the spreadsheet and forward it on as needed. So that concludes the CST, the LEAD tool. Again, I want everyone to understand this begins with an overview and walks through the prep phase, and then during the initiation of the exercise, and then actual observation, walks you through the facilitated discussion in terms of patient beds, transport, or other topics, and then it walks you through the AAR portion. That concludes the hands-on demonstration of the LEAD tool. We are now going to look at the evacuation tool. This tool is used at the evacuation hospital. Thus, we call it the EVAC tool. The first page of the other tool and the EVAC tool are almost exactly the same. It just gives you information about how to execute the exercise and what each of these other spreadsheets is for. This is a document here. You press on that, and this is a evacuating facility exercise table. So there are 7 different types of beds, different bed types we're looking for: long-term care, general med surge, ICU, peds, NICU, psychiatry, and labor and delivery. The evacuating facility can use this to identify receiving facilities, whether this is coordination by an RHCC, yes or no, or by them or by some other entity, and then how many beds that they were able to identify from each of these receiving facilities. So this is if the evacuating hospital has a different system that they use, that's fine. They should use whatever they would use on game day, not necessarily this table, but if they don't have it, you as the assessor at the evacuating hospital should make sure you hand it to them and provide that to them, and they can begin tracking this information on. In addition to the receiving hospitals, we have vehicles recruited for patient transportation to be identified here as well, ALS, BLS. So a lot of the information that we asked about on the previous tool during the facility discussion is collected here during the actual evacuation portion of the exercise. That's the Microsoft Word document right there, and you make sure you have that hand them when you walk into the hospital that's evacuating. On exercise initiation, obviously you're going to type in the name of the evacuating facility. You're going to read the scripts here, and you can start it, and then it'll pop up after 90 minutes. It'll tell you at the end of the exercise. So here's some instructions you can read, and here's some additional FAQ questions with some information you may be able to share with the players. So during the actual exercise, again, we're looking for some qualitative observations from your peer assessors. This is very important, having your peer assessors involved. Peer assessors should be folks who have professional knowledge of healthcare emergency management, of healthcare coalitions, about how the healthcare system would respond during an emergency. This person or these folks don't necessarily have to come from your healthcare coalition. If they come from even an adjacent healthcare coalition, that's fine. It's good to get different perspectives. They can get some ideas from how your healthcare coalition responds. They can give you some ideas from how their healthcare coalition responds. So they can bring some best practices to you, and they can take some best practices back to their healthcare coalition. So again, those are the different questions we went through in detail during the other spreadsheet review. Here at Notes, facilitate discussion will be led by the lead peer assessor. However, it's important to share your feedback and input and perspective from the evacuating facility. So here's some notes that you want to type in that will come up during the facilitated discussion, as well as notes for the after-action review. So that concludes the evacuation tool. After you're done with both the initial exercise, your facilitated discussion, and then your after-action review, when that is all completed, then you're going to be reporting back up to the awardee, who's going to report back up to HPP. In addition to the Excel spreadsheets that you're going to send up, there'll be after-action reports. Well, that concludes my review of the Coalition Surge Test today. Some general tips that we found from folks who've used this is that engage your healthcare coalition early. Discuss that this is a requirement for HPP-funded healthcare coalition in the country. So this is a low to no-nos exercise. Make sure you have selected peer assessors who understand both how your HCC is organized and what is expected of each HCC member during this scenario. If you have additional questions or concerns, I recommend that you contact your HPP field project officer. That concludes the hands-on demonstration of the Coalition Surge Test. Thank you.